Hi, viewers all over the world. My name is Apostle Helen Rudokino, coming to you live on the waves of Majesty Christian Television Network. This wonderful day, we have a one-on-one with a young, dynamic medical doctor we have fallen in love with, and we are so proud of her. I was just telling her, by the way, that the day she's going to marry, she must make sure that we are there. Because when you see people of honor in this manner, I mean, you want to identify with whatever they are doing. So we will be having our guest. I don't need to bring her out now, so I just want you to remain in darkness for a while, and then afterwards we're gonna just zoom her on and you will see who she is. But our topic with her this wonderful day is going to be on her research findings on cancer, and at the same time on her latest book, which has to do with how to survive stress and improve personal professional productivity. That's what is written here. Very soon I will put her on and then she can explain by herself what she meant by that. But as an introduction, I want us to know that medical researchers all over the world are very, very busy, committed to looking for a better way or a better solution on how to deal with cancer and provide the treatments. So researchers have also found out that chemotherapy reduces the risk of death or cancer progression by almost 80% in patients with previously treated CLL. I don't know what that is, compared to those who use BR alone. So this finding represents a significant advancement in the management and treatment of leukemia, says Dr. Chanan Khan. And he comments, he says, although cancer remains incurable somehow, but their latest finding offers longer disease control and a decreased risk of relapse for their patients. So our guest today is Dr. Nupur Kohli, a young medical doctor from the Netherlands. She is also aspiring to make medical care worldwide more efficient. So she is a versatile and a sought after public speaker, a medical doctor who did master's degree in medicine at the age of 23. She's a trainer, she's an entrepreneur, and at the same time she has become a writer. So please, wherever you are, help us receive Dr. Nupur Kohli on Majesty Christian Television Network. Welcome, Doctor.
Thank you.
We are so
Thank
proud of
you.
you.
I'm really happy to be here on the TV
We are
show.
so proud of you, honey. We are so
Thank
proud
you.
of you. So you are here to talk on two things. You are going to talk on your medical research regarding cancer,
Yes,
and you're also going to talk about your new book.
absolutely.
I'm so excited and to know how this book is going to provide solution to the stress-related diseases, probably.
Yes, also that's also a part of it.
Okay, so tell us a little bit about um, this research you've done on cancer. Tell us a little bit, and why did you do your research on that level?
Okay, so I think for the viewers who are watching, it's first of all very important to understand what is cancer actually.
Okay,
And I think it will be nice to explain that first.
yes, tell us.
So, cancer is actually your body has a lot of cells, and when a cell divides, it can turn into another dangerous cell,
Okay,
and that dangerous cell can become more dangerous cells.
okay.
And a group of dangerous cells is called cancer.
Oh, really?
Yes.
It's so easy.
Well, I'm explaining it in a very easy way.
Yes.
So, this group of dangerous cells called cancer,
Yeah.
they can destroy things in your body, and they can also go, if it's a very dangerous form, to several parts of your body. And that is harmful.
It is. So what is it that triggers a cell to begins to divide?
So usually your cells divide because you get new skin cells, your hair grows, those are new cells.
Yes.
But sometimes when a cell divides, there can be a problem in between. There can be, in that cell can happen something while dividing, and then it turns into a dangerous cell, and you don't know when that happens.
Okay.
So it can be, sometimes it can be because it is in your family.
Okay.
And sometimes it can be perhaps if you were smoking, that can change your cells.
Okay. Really?
So there can be different factors.
Okay. So that means when the cells are divided, they can be divided for good, or they can become bad cells.
Yes, exactly.
Wow.
So they can become either good or bad. And most of the time they are good, but when they turn bad, they can become dangerous, a cancer cell.
Right. But there are some people who do not smoke, but they still have cancer.
Yes, there are some people who don't smoke and still have cancer. So then sometimes there is no specific reason why it is like that. And even we doctors
Yes.
don't know yet why is it that it happens this way. And that is why among that research is very important to find out what can be a cause.
Right.
And how to treat it best.
Okay. So I believe you are one of the doctors that would want to improve Medicare all over the world.
Yes,
All
absolutely.
right. Now, so was that the reason why you made your research specifically on getting towards cancer?
Well, that is one of the reasons, because cancer is something we should know more about. It happens a lot all over the world, and a lot of people don't understand why cancer is there.
Yeah.
So it's important to find out if there are better ways to treat it, and if you can increase the life of patients.
So what type of research then have you done regarding to this?
Yes, so the type of cancer I am currently doing research on is a cancer of the ovaries.
Okay.
So that is, you have your
Yes.
uterus and you have
Yes.
your ovaries.
Yes.
So that's the type of cancer I research. And this is also a type of cancer from which people can die. And what I do
Yes.
in my research is I research what are the best ways to treat it, what type of chemotherapy and what type of surgery.
So what results do you have so far regarding to this ovarian cancer?
So the research is still going on, and so the results are still coming in. And what is important to understand, also for the viewers, that cancer is not one thing. Cancer is in different stages.
Yes.
So you have a low stage and you have a high stage. And in a low stage, it can sometimes still be cured, but when it's in a high stage, like you have stage 1, you have stage 2, you have stage 3, you have stage 4.
Yes.
But sometimes in a high stage, it is difficult to cure.
Exactly.
And in my results, what I have found till now is in this type of cancer that in the low stage, surgery is sometimes enough, and in the higher stages, we will add a certain type of chemotherapy, and that can help in surviving.
So, Dr. Nupur, at what point does it progress to, let's assume, from 1 to 2 to 3, and then when it's 4, it's now high, is that?
Yes.
So what makes it to progress that way?
So if you don't find the cancer early enough, the cancer can grow.
Oh.
And there are certain rules doctors have set up, what is stage 1 and what is stage 2. For example, in my type of cancer, stage 1 will only stay within one organ. If it goes outside the organ, if it grows that much, it can become stage 2. if it, for example, also spreads to other parts of the body,
Yeah.
then it can be a stage 3. And it depends on when you find the cancer.
Yes. So, from your research findings, cervical cancer, is it peculiar with which age of women?
Okay. So the type of cancer I research is an ovarian cancer.
Ovarian cancer,
Young
yes.
women can get it also, but it is more at an older age. So from 40 to 50 years old. But this is not the most
Wow.
common cancer, because we were speaking before that
Yes.
breast cancer
Yeah.
is a very important type of cancer that also now more young women can get. So it is more in older women from 40 to 50,
Mm-hmm.
but even younger you should pay attention.
Yeah. So why didn't you pay more attention on maybe the breast cancer, which you are saying as a young woman? I mean, to save so many other young women than this ovarian one,
Yes.
because ovarian starts maybe from 50, as you said.
Yes.
Okay. So why don't we? Why didn't you pay more attention on the other one?
There are a lot of doctors who do research on breast cancer, and
Okay.
within my the group, I was asked to do research on
Okay.
this particular subjects, and there are a lot of doctors who do a lot of good work to also do research on breast cancer.
Wow. Well, those of you who are out there listening to us, we are having one-on-one with Dr. Nupur, who is doing his research on ovarian cancer.
Yes.
And at the same time, she has authored a book on how you can deal with your stress and improvement on working improvement on stress. Is that
Yes, improvement in stress,
In
to
stress.
have less stress actually.
how to have less stress?
Yes.
Wow. I think every person will be very, very interested in knowing how to improve on that, because stress is something that just is ravishing our uh, generation, and so many sicknesses can still be developed through stress. So many chronic sicknesses come through stress,
Yes, a lot of
including cancer too, probably. I don't know.
Well, that it can play a role as well. Stress is such a thing that everyone in their lives have stress in different ways. And like you say, it can play a part in having the chronic diseases as well.
Yeah.
Some people, because of stress, start to eat a lot,
Okay.
or they start drinking alcohol or smoking. So that kind of things also happen. Or if you have a lot of stress, you can have sleeping problems. So
Yes,
a lot
okay.
of things.
Really? Um, so, if all of these things are stress can make one have become overweight. Stress can make one, because when you are eating too much, then you will be adding weight, isn't it?
Yes, when you're eating too much, then you add weight.
And then the person also becomes sleepless again.
Yes, it is all related to each
So
other.
we are not diving into your book now.
Yes.
But when we will dive into your book, do you think you already have solutions for, as per how people can, minimize their rate of stress?
Yes, I will discuss in the book as well solutions to survive your stress better.
Okay, that's very good. The next question is, from your research findings or studying, what is the future for women as at now, when it has to do with this ovarian cancer?
So the future for women who has this ovarian cancer is that when you feel certain vague symptoms you don't understand, like for this type of cancer it would be a pain in your stomach you don't understand, or you see your belly becoming bigger and you don't understand it, you feel something there. If you find things you think I don't understand it and my doctor also does not understand it quite well, your general practitioner, then you
Yeah.
have to think further. So the future is about paying attention, and we are able eventually to better treat it as well.
Okay, so we should explain that symptoms again. When you are having a big tummy, when
Yes,
your stomach is
if you
beginning to
yes if
bulge,
yes bulge that can
and then
be.
you are having pain.
Yes,
At
when you're
what
having
point,
pain.
at which side of your stomach are you talking about now?
Well, it will be in the lower. It will be in the lower part of the body. It can be a vague type of pain. It can also be that your stool, when you go to the toilet,
Yeah, yeah.
if that changes, then you should pay attention to that, and when there is a moment when you're above 50 and you stopped menstruating,
Yeah.
and you would start bleeding again,
Okay.
that can be a sign of perhaps I should go to the doctor and ask, is this okay?
Really?
So those are a few things. And if we would, for example, look at the breast cancer,
Yeah.
so what women can do is, not a, you don't have to do it every day, but once in a while you can feel the breast.
The breast.
Yes.
Really. You feel it.
And check if there are any if you feel something abnormal there, and if you do, go to the doctor. Other things you can pay attention to is, for example, if there will be coming some water again from your breast, or the color changes.
Is it water or is it the milk?
Well, it can look like milk or a bit yellowish. The thing is, there should not, if you don't have babies, there
Yeah.
should not come
Any
anything.
fluid?
There should not come any fluid.
Wow.
And if it happens, then go to see your doctor and ask the doctor what you should do then.
Mm-hmm. Yes. So you haven't still answered my question. From your findings, your research findings. So what is the future holding for women regarding ovarian cancer? Is it that it is high or is it low?
Well, it is currently it is high, and the future is that we will be able, with a certain type of chemotherapy, make the lives longer. Do I answer your question?
Yeah,
with
sure.
that?
Yeah.
Well, I'm still getting the results,
Yeah,
so I
okay.
can't fully say sure
Mm-hmm.
we will do it, but that is what the results are showing me now.
But Nupur, I was really reading something, and a doctor was commenting that chemotherapy, I'm sorry to say this, chemotherapy is not really helping because doctors go about prescribing radiation treatment and this and that, even when they know that those things are not helping, because that thing only holds the cells or deals with the whatever for a while, but it doesn't really prolong life. It doesn't really cure the sickness.
Yes.
Okay, so why can't they come out and be blunt to tell us there is nothing that can cure cancer?
I can give an answer to that, but perhaps makes it understand better. You don't have one type of chemotherapy.
Oh, yes.
You have many different types of chemotherapy.
Yes.
And I don't know why this doctor said the chemotherapy does not help. I don't know what his reasons were.
Yeah.
But in certain cases, doctors can consider to use a different type. And
Yes.
I don't know the specific cases. I cannot comment
Yeah,
on
yeah,
that.
yeah.
But because like you have different medicines, you have different types of chemotherapy. And apart from chemotherapy, there are some new medications also developing that are different than chemotherapy. But that is something for the future. And
Yeah.
unfortunately, I have to say that will take a little bit of time. So it's a terrible disease. I agree with you.
Yes. So currently, what is the ratio? How many women are having are prone to this ovarian cancer? Well, give us a rough idea of the ratio? Is it like 10, 8 to 10, or give us a little bit
Yes.
from your findings?
Okay, so it differs for every country,
Yeah.
but from every currently I can say for the
Please, sorry.
currently I can say for the Netherlands that from all the women who are having a cancer in ovaries, the type of cancer I'm researching, that is about 100 a year, perhaps. It's not much.
About, I mean?
100 a year. It's not much.
Yeah.
The type I am researching.
100 a year?
Yes.
So
So
it's much too.
it's still much.
Yeah. Wow. 100 a year? If 100 women will have ovarian cancer a year, it's much.
It is much.
Oh my God. So, but are there certain things people are supposed to do that can help them, that can help to put a stoppage to cancer as a disease?
Currently, cancer cannot be stopped yet. It's not a good. It's not nice to say, but
Yeah.
if it's in a low stage, then you can cure it. But the any type of cancer to completely stop that's a difficult thing to do.
Really? So, there's no solution at all?
Well, not a final solution. The only thing we can do with what we know now is help people the best way we can.
Yes. But there are some people, just the mere fact that they have been told that they have cancer, they already begin to die.
I can imagine people think that way because it's a terrible thing to hear
Yeah.
that you have cancer, but I do wish to tell people that you should not give up when you
Yes.
hear something
Okay.
like that, and there are very good specialized doctors who can explain you very well what the next steps are, and there are also types of cancer who are curable because
Yeah.
cancer is not only one thing.
Yeah.
It can be in different types of the body, and every type of cancer acts in a different way.
So, this is a final question on this particular topic.
Yes.
The doctors in Netherlands, have
Yes.
they been, has it been very successful for them to cure ovarian cancer?
The doctors I know are very good in their work. The doctors, especially in the academic hospitals,
Okay.
and there is a cancer center in Amsterdam. There the doctors are very good, and successful or not, it also depends on the patient and when you detect the cancer. So the doctors always do their best.
The best. So there is a little bit of hope.
I do believe there is hope because we keep improving in how we treat it, and we keep improving, and that is the best thing we can do.
Okay. Well, somebody out there listening to this broadcast, we are having one-on-one with our dynamic Dr. Nupur, and at the same time, we would like you to give us a call on the studio line 020 337 4160. Should you have any question for Dr. Nupur, just give us a call right now. She is live on the studio of Majesty Christian Television Network, and she will, I believe, if you ask her something relevant to what we are discussing, she will be able to give you an answer that will make your heart to be settled. Thank you so much. And now, let's move to your book. On your book, it's titled How to Survive Stress and Improve Personal and Professional Productivity.
Yes, actually, the whole title is
It's too long.
Chill, How to Survive Stress.
How to survive stress.
So it's mainly about how to survive stress and how in your life you can deal with whatever stress you you have.
Yeah, exactly. So, how did you choose this topic? Why on stress? Why not on diabetes or this, that, or that? And then why did you choose this topic?
So I am a medical doctor, and stress plays a role in many different types of health problems.
Yeah.
And it is this one thing many people don't immediately pay attention to.
Okay.
That perhaps if I reduce my stress or
Yeah.
if I do something about it, my
Mhm.
other problems can be less as well.
Yeah. Oh, so?
And that is why I chose the topic of stress, because it is something you can actually help to improve and reduce.
Really? So you can have control over your stress level.
Yes, you can have control over your stress level.
So tell us a little bit about this book.
So this book will not only speak about what stress is, but it will also look at different groups of people and how they um, what stress is for them,
Yeah.
and how they deal with stress. Stress is different for a housewife,
Okay.
and stress is different for a manager working in a company, and they will deal with it in different ways.
It's true. But to a layman, a lay person out there listening to you and I right now, how best can you define that time stress to that person who is watching?
So, stress is when you feel a lot of tiredness. Stress can be when you are so busy in your head that it is hard to find out what to do when. Stress can also be that it is hard for you to sleep. Stress can be in many different ways.
So when somebody is finding it difficult to sleep, it means the person have a high level of stress.
Well, a high level of stress can play a role in your sleeping problems.
But
It can be a cause.
yeah, but is it for a younger person or for older people? Because I've also heard that when women are going through the menopausal syndrome, they cannot sleep.
What? Sorry, you have to.
When women,
Yeah, menopause.
yeah,
Yes.
so that's one of the menopausal syndrome.
Yes.
Eh? Okay, so is that a stress level as well?
Well, stress plays a role there as well. A woman's body goes through many things, and there comes also a bit of stress with that.
Okay.
So if you learn about solutions and techniques to reduce your stress, it might also help with your menopausal problems.
Okay. Right. So are there young people like you
Yes.
who are stressed up?
Yes, as actually nowadays there are a lot of young people like myself who have a lot of stress. Part of that is we have a lot of technology.
Yeah.
And you have your phone who beeps the whole day.
Oh my God.
All these calls, and you get a WhatsApp, and you have Facebook, and you have
Oh
internet.
my God. Yeah, yeah, yeah.
And it is very stressful for a person to have this little small thing
Controlling you.
who is controlling you all the time, and
Oh
that
my
is
God.
terrible.
Exactly. Even when you are sleeping,
Yes.
it's by the side of the bed,
Yes.
controlling you.
And it says beep, and it says
Yeah,
beep.
yeah, yeah.
So for us young generation, that is one thing that creates a lot of stress.
Wow.
And in my book, I will also speak about how to deal with that. How do you manage that?
Yeah.
How do you manage your gadgets as well to reduce your stress?
Really? Yeah, but I we would like to talk more about the symptoms of stress.
Yes.
Okay. The symptoms of stress which you have found out and
Yes.
have made you to write this book
Yes.
are that people are sleepless.
Yes, and you can also have a
Headache?
higher your headache. You can have a higher heartbeat. You can be
Heartbeat.
more sweating sometimes. You can have the feeling that it's hard for you to think.
Yes.
And those are the main symptoms. Sometimes you can also feel a bit nausea if you're very, very stressed.
Mm-hmm.
It is,
Feel like vomiting.
yes, feel like vomiting.
Mm.
For some people, um, it can be when they have a job interview, for example.
Mm-hmm.
If
Mm-hmm.
well, viewers are watching, if you go for a job interview, what you feel there in your body,
Yes.
that is also stress.
Okay.
So you can compare it with that. So you have your heart beating, you feel sweating.
Mm-hmm. Awesome. So how can one get, apart from some of these things you've mentioned, are there other ways that one can get stress? Maybe stress in the society, or stress because of job, or stress because of marriage?
Yes,
Maybe?
yes, certainly. Actually, society and both work. They will be both mentioned as well in the book. Can play a role because society can put a certain pressure on you
Yes.
on how you should
I
behave,
forgot that.
how you should behave or how you should act, and that can give you stress as well. It can make you worry. Should I do what my neighbor says? Should I do what my sister says?
Yes. Okay.
And on work, you have different people. You have all your colleagues, and your boss who perhaps says, do this, do that, do it this way. All kinds of things people have to deal with.
So, in a nutshell, when people are controlling your life or looking for a way to control your life or manipulate it, it can cause a stress level,
Yes.
or even the society as well.
Yes.
When society is putting up pressure, you have to do it this way. You have to, you have to do it this way. You have to accept this sort of group and this sort of group and this sort of group. So without you accepting them, you become like somebody violating the law. So such pressure can make you to have a high level of stress.
Yes, such pressure can make that you have a high level of stress, and it is important for yourself to learn ways on how you can manage that.
How can you manage it, honey? Can you tell us a little bit?
So some ways to manage that are that you change your way of thinking. So it is teaching yourself, it is a way of teaching yourself how you can change your way of thinking. So that is one thing. There can be certain techniques with which you can relax your body more. So those are a few examples.
Yeah.
I won't go now into details, but
Okay.
there will be more. I will mention that, how to do that.
Later on.
Yes, later.
Okay. So what do you mean by changing the way you think? Let's assume you are in a society where certain norms are good for them, but for you it's not good. So you now have to change your mentality. Is that what you mean? To accept that which you think is wrong, you accept it because the society thinks it is good. So my changing my mentality or my mindset means I have to accept what the society wants. Is that?
It is part of that, but what I also mean is changing your thinking about yourself, getting more the self-confidence
Okay.
that you can tell the other person in society, this is the way I feel about it. This is the way I think about this.
Mm-hmm.
And not taking everything very personally,
Mm-hmm.
but believing in yourself. And that is also a big part
Yeah.
of it.
You think that can solve that problem?
That is not the only thing, because
Okay.
also there are also other techniques, like we call it yoga, but there are techniques from yoga. Those are also part of the relaxation techniques. There are certain things in exercise you can do
Mm-hmm.
that can help you as well.
Okay. Well, for me as a reverend minister, we don't practice yoga,
No. I don't.
We think maybe there are other ways you can deal with your stress level. You know, we believe that you can always do other things to
Yes.
learn a better way of handling
Yes,
your
well,
situations.
for a lot of people, and perhaps you agree with me as well, their faith is a very important thing to reduce stress for themselves, and that can also be a way. It is just finding the right technique for yourself,
Yeah, yeah, yeah.
and it's important that people realize that.
So, what are some of the solutions you intend to provide through your book?
Yes, so some of the solutions I will be speaking about those exercises, because when you release energy in a different way,
Yeah.
then you can reduce stress. It can be different types of food you can eat
Yes.
that can reduce stress. It is part of that is also the thinking.
Yeah.
Actually, what a core thing is in this is that you replace stress with things that create joy
Yeah, yeah, yeah.
in you.
Okay. Did you write those things in your book?
Those will be in my book. Yes.
Really?
Yes.
Because I'm getting very interested. I want to know some of the things that can reduce the stress level and some of the solutions you have to offer as a medical doctor.
Yes, and I think a lot of people will need this.
Yeah, I think so too.
And also, I was speaking about the technology. I will give examples of how to deal with your gadgets.
Yeah, exactly. Exactly.
Not looking at it every moment of the day, and how to do that. It's very important because we live in a very fast society.
Yeah. So when are you going to give those tips?
You mean my book?
Yes, on how to deal with the gadgets, because I believe those who are out there listening to us, even myself, I'm very curious. How can I deal with my gadget? Look at this one. It's almost controlling my life.
Yes, exactly. So I will, it will obviously also be mentioned in the book, but there are certain apps also available
Okay.
that can measure for you a sort of downtime. You can tell the gadget, I will now have downtime, and for half an hour, you cannot touch your phone. Those type of apps are available.
Really?
Apart from that, there is a function. There can be functions as just turning your internet off for a while, or what I do sometimes
Yeah.
is creating the discipline in myself to just turn my phone off, and for 1 hour I won't even be looking at it. But
Really?
that is something you have to practice, and you will feel much more relaxed.
Relax. Really?
Because you know nobody can call you, nobody will.
No, people will call you, but you are choosing to ignore.
Yes.
That's the meaning.
Yes. You're choosing. Ignoring is a big word.
Okay.
But it will be good if everyone understands that you can call them back sometime later.
Okay.
And that if you do it, they can also do that. That it will be better for everyone to not expect every second of the day an immediate reply.
Wow. Now look into the camera and tell us some of the consequences of high stress level.
So some of the consequences of high stress level can be, in the end, a high blood pressure.
Wow.
For example, that can occur. High levels of stress, if you have it also on your work, could create something that we call a burnout.
Burnout, yes.
Yes, it can create anxiety within you. And those are just three things. And if you eat a lot because you have stress, then you gain weight. So it has a relationship with different things.
Awesome. So before we sign up now, so what is your last intake on this? What advice are you giving to those who have watched us and who will be eager to read your book?
Okay, so a last...
Well, by the way, when is this book coming out?
So the book will be coming out about end of this year.
Okay.
Begin next year. I'm busy with my publisher.
Okay.
I have an American publisher. I'm busy with that.
Okay.
And if people wish, they can go to my website and sign up for a free downloadable version. When it will become available, I will
Awesome.
inform them.
Really. I would like to go and read something.
Should I say my website
Yes,
here
yes,
now?
yes, oh, yes, why
So
not?
you should go to www.nupur,
www.
that is NUPUR.NL. And if you go there, you can sign up and give your name there, and when the free downloadable version of my book comes available, then I will inform the people about that.
Wow, awesome. Nipple, let's just digress before we sign up.
Yes.
You are also the president of the Indian Diaspora Youth Association.
Yes, I'm a board member of the Indian Diaspora Youth Association, yes.
So, what do people really do?
So, in the Indian Diaspora Youth Association, young people from Indian origin organize events to tackle taboos.
Oh, really?
Yes, and there can be different type of taboos, how to do better in your education, or how do people, what problems are there in society.
Yeah. Awesome.
So actually, we are having an event this Saturday.
Oh, Nipple, tell us about the event.
So this Saturday, the Indian Diaspora Youth Association will have an event on what the role of women is in society.
Oh, that's a very good topic.
It is a very nice topic, and we will discuss the role of women in society, and related to that, also how what problems they have in society.
And where is this going to take place?
Well, this will take place this Saturday, 6th of June, in
6th
The
of June,
Hague.
in The Hague.
And if you are interested, you can also go to Facebook.
Okay.
And if you look for Indian Diaspora Youth Association, you can find there more information how to sign up, how to register for the event.
Awesome. I would really like you to also meet the Nigerian diasporas.
Yes,
Yeah,
certainly.
I would like you to meet the youth Nigerian diasporas as well.
Oh yes, that will
So-
be great to do that. Absolutely.
Thank you so much for your time.
Yes.
And is there any other thing you want to say before we sign off?
Well, it was wonderful being here in the show, and do go to the website www.nupur.nl, and if you are interested in the book,
Yeah.
you can sign up there for a free downloadable version when it comes
Nupur
available.
is Nupur.
NUPUR.
So go there and then get the best out of Nupur. God richly bless you, honey.
Yes, thank you
Thank
so
you for being
much.
with us.
It was wonderful being here.
Thank you, thank you, thank you, thank you. Well, that is it for today, and we thank you for being with us, and we hope that you will just go to the website of Nupur and get